Together we achieve victory over heart failure.
Monitoring your heart failure conditions. Know your vitals. Welcome back, listeners. This is Dr. Priyanker Mondal, Senior Consultant Interventional Cardiologist at Anandalok Multi-Specialty Hospital, Siliguri, West Bengal. And today, we delve into a critical aspect of healthcare, monitoring of the heart failure conditions. It is very difficult to notice the heart failure right away. As our heart faces increased strain, it compensates by working harder. Yet, as the heart failure progresses, its ability to pump blood diminishes gradually. Over time, the subtle changes may go unnoticed, emphasizing the importance of recognizing the heart failure symptoms. Swelling in the feet, ankle, or abdomen, along with the sudden weight gain, are common signs of right heart failure. Monitoring weight gain can also help to manage the swelling. Shortness of breath during daily activities or interruption in breathing due to persistent coughing, wheezing warrants medical attention as it indicates a LV failure. Difficulty in sleeping may also indicate heart issues. Fatigue, confusion, or fainting may signal inadequate flow to the brain. Other symptoms like rapid heart rate, nausea, lack of appetite could also indicate the heart problem. If you notice any of these signs or symptoms, seek prompt medical care. Now let us discuss about certain parameters. Firstly, the blood pressure. Now, as per the recent 2024 European guideline, hypertension categorized as per the type of BP we are measuring. We can measure the office BP, we can measure the home BP, we can measure the 24 hours ambulatory blood pressure, and that can be further subdivided into daytime ambulatory blood pressure monitoring or nighttime ambulatory blood pressure monitoring. And accordingly the cutoff value varies. Now think about the office BP monitoring. Now in office BP we term hypertension when the cutoff value is more than 140 by 90, 140 systolic and 90 diastolic and above. In case of home BP, if the BP is 135 or 85 or more. Now elevated BP, the new term, is coined when the BP, office BP, is in between 120 to less than 140 systolic and diastolic 70 to less than 90. In case of home BP, systolic 120 to 135 and diastolic 70 to 85. Now, non-elevated or so-called normal BP in new guideline, when it becomes less than 120 or systolic or 70 diastolic. In case of home, it's the same, less than 120 by 70. In case of ambulatory blood pressure monitoring, the daytime less than 120 by 70, just like home and office BP. In case of nighttime, less than 110 by 60. It is the normal or non-elevated BP as per the recent guideline. In case of hypertension, when it term is at a hypertension as per the ambulatory blood pressure monitoring, when daytime is more than 135/85 or nighttime more than 120 by 70 or as a 24 hours when the cutoff value is more than 130 by 80. Secondly, if we think about the lipid profile, now lipid profile has got several components like total triglyceride, HDL or high density lipoprotein, HDL cholesterol, LDL cholesterol, VLDL cholesterol. Now, as per the Indian guideline, this is the new guideline that has coined by Cardiological Society of India, CSI. They have come up with the Indian guidelines. Now, management of dyslipidemia and lipid goals. And lipid goals are mainly set in view of LDL cholesterol and non-HDL cholesterol. Now, unlike European country or American country, they have their individual score system. But we are Indians, we don't have this kind of data to formulate a score. And our risk assessment and categorization has been done in accordance with the presence of risk factors, but not in the formulation of score system. Now, due to certain risk factors are taken into consideration, and accordingly, any individual can be classified as extremely high risk, very high risk, moderate risk, and low risk. And the target value for LDL and non-HDLC cholesterol has been set up in accordance with the risk factor or in accordance with the risk category. Say for example, if we think of an individual that comes under the category of extremely high risk, the target of the LDLC cholesterol will be less than 40 and non-HDL cholesterol less than 70. If we further categorize, what should be the criteria for extremely high risk? It is atherosclerotic cardiovascular disease in the form of MI, stroke, documented stroke, or elevated LVL, elevated lipoprotein A, or hereditary familial hyperlipidemia, along with any incidence of polyvascular CVD or atherosclerotic cardiovascular disease, or any recurrence of it. Those are the criteria for individual to comes under the category of extremely high risk, and the target value is LDL cholesterol less than 40, non-HDLC less than 70. In case of very high risk, atherosclerotic cardiovascular disease, either CAD, coronary disease, or peripheral vascular disease, or cerebral vascular disease, or imaging there is a lesion more than 50% in any of the two major vessels, or diabetes more than 20 years, or multiple risk factors, target organ damage, hereditary familial hyperlipidemia with atherosclerotic cardiovascular disease, or CKD grade 4 and low. For there we have a target value of LDLC cholesterol less than 55 and non-HDLC less than 85. Now to come to high risk. High risk we term when an individual having a diabetes or one or more risk factor, CKD stage 3, hereditary familial hyperlipidemia but no other risk factor, hypertension or one or more risk factor, a target organ damage. For there, the LDL cholesterol target will be less than 70, non-HDLC less than 100. For moderate risk when any of the risk factors is present. Number 1, diabetes, hypertension, tobacco, or family history of young ASCVD. For them, the target value is LDLC less than 100, non-HDLC less than 130. For low risk, where there is no risk factor, LDLC cholesterol less than 100 and non-HDLC less than 130. Now, if we think about the heart rate, normal heart rate is around 60 to 100. If the heart rate is below 60, we call it a low heart rate or so-called bradycardia. And when the heart rate is more than 100, we call it a tachycardia or high heart rate. Now, arrhythmia, be it a bradyarrhythmia or tachyarrhythmia, can happen in different forms and accordingly different symptomatology might be there. This concludes today's discussion on monitoring of the heart failure conditions. Remaining proactive is the key to safeguarding your heart from heart failure. Thank you.